Welcome to Faith, Fiction, and Folklore, or as we like to call it, the Try F podcast, where we try not to F the podcast up. And this is a continuation of the Senate hearing on the COVID-19 vaccinations. We hope you enjoy.
To have your citation on that, so if you can give us a study so we can put that in the record, and any other citation give us on the millions of lives saved by vaccines as well. I mean, I want to know the truth. Just real quick, I've got a couple other charts I want to put up there. This is a chart, a lot of people produced it.
Chairman, if I could just interrupt for 10 seconds over here.
Sure.
Is today's just a point of order? Are we talking about vaccines or are we talking about the COVID?
There we go.
Well, specifically, we were talking about the hiding of the safety signal on myocarditis.
So we're not talking about all vaccines?
We can talk about anything you want to.
Okay.
I mean, again, it has obviously opened up because we're also talking about the corruption of science. And I think science has been corrupted. So fair game. So, and again, I appreciate you staying here and stick around and ask a lot of questions. I think you'll learn an awful lot. Put my time back on the clock. No, I'll take whatever I want. This is a chart. This is a chart. Again, I was looking at the VAERS. You know, I had been.
Mr. Chairman, that's not the way I ran this subcommittee.
I had been. Well, this is a different. Again, I'll be very generous. Okay. I was actually instructed as a non-doctor what the COVID injections were. Encapsulated lipid nanoparticle that was designed to permeate difficult to permeate barriers. So they lied to us when they said they'd stay in the arm. They knew it wouldn't. They had a study, the Japanese regulators uncovered that when they did do a biodistribution study in rats, it distributed all over the body. So that was the first lie. Didn't really talk about too much about the toxicity yet of the lipid nanoparticle, but it goes all over the body. So I was aware, and again, that this was not a standard vaccine. This isn't a attenuated or dead virus that the body reacts to. This actually hijacks the cell, has the cell produce the spike protein, which is toxic to the body, which means the body attacks it. Again, I'm a layman, but it's pretty simple for me to understand this. So I was aware of this like in October. So I'm watching VAERS, and so I'm publishing these charts, and I'm being censored. I see the next chart, chart number 2. This is the full history of VAERS and the number of deaths being reported associated with the vaccine. You got a couple hundred a year until 2021, and yikes, 21,725 deaths worldwide. Why? And everybody's saying, no, this is safe and effective. The vaccine injured were being gaslit. They weren't being treated. They're still being gaslit. There is no, by the way, there is no compassion, Governor. I could fill this room with photos of people who are dead because of the COVID injection. I could fill the room. And that is being denied. That is being denied. It is being denied. And these people haven't been able to get help. I held an event in Milwaukee in June 2019 and 2021, and all the vaccine injured, those women, all they wanted was to be seen and heard and believed, and they are not to this day. Okay? So again, they're not the ones politicizing. They just want to be helped. They want compassionate doctors to treat them, to recognize what caused their illness, not gaslight them, not deny that it exists. But anyway, so you take a look at this chart, and they're still denying that this, nothing to see here. This is safe and this is effective. Okay? Next chart. This is the current VAERS chart. 38,607 deaths reported worldwide associated with the COVID injection. And we know VAERS dramatically understates, by a factor of 10, 100? We know it understates it. 9,228 of those deaths are occurring on the day of vaccination, the 1 or 2 days. Okay, I know VAERS doesn't prove causation, but man, that's a correlation we should have been looking at, but they ignored and they censored. But enough of that. Dr. McCullough, please, in my layman's terms, I just kind of laid out the harmful mechanisms of this injection. Can you and Dr. Vaughn, because I think you've both spoken to this, again, in layman's terms, talk about why this caused so much harm in so many different ways because of the biodistribution. Dr. McCullough.
80% of Americans took a vaccine. 20% didn't. 20% did not take a vaccine. The vaccine was never safe enough for me to take. Messenger RNA devised by Pfizer and Moderna has been chemically modified to be unassailable to enzymes in the body to be broken down. The messenger RNA is found in the human heart of people who die after the vaccine. It's found in the brain. The spike protein is found everywhere in the body. 3 studies now show the spike protein is circulating in the blood for 6 to 9 months after people take the shot. This part of the virus, the lethal part of the virus in the vaccinated, it's circulating in the blood. And then they take a booster, they get more circulating in the blood. It is a killer protein. It cannot be safe. It was not safe by design. Safety trumps efficacy. We cannot tolerate false drug claims. And we saw a poster behind Senator Blumenthal making a false drug claim that vaccines saved millions of lives, specifically the COVID vaccine. Well, let's take a look at that. When someone signs consent for a vaccine, Senator Blumenthal, does the consent form say it's going to save their lives? Of course it doesn't. It's not on the FAQ. There's never been a prospective, randomized, double-blind, placebo-controlled trial ever showing that COVID-19 vaccines reduce mortality or hospitalization. There's not even a valid non-randomized study. Thankfully, COVID mortality went down for 3 reasons. Because we all got the infection, vaccinated and unvaccinated, so we developed population natural immunity. We developed early treatment. Credit to Operation Warp Speed. We used all the Operation Warp Speed tools, additional drugs. We treated patients with multi-drug protocols at home so they don't go to the ER. So Governor Green never saw the patients we treated because they were successfully treated at home. And the third reason is the virus mutated to a much milder form. Those things happen concurrently with rollout of the vaccine. The vaccine cannot be falsely credited with saving millions of lives. We can't allow false drug advertising to be put up on a poster behind one of our public servants. We cannot accept that.
So let me quick.
Guess those posters upset a few people.
And I will have a lot more questions. Put up that optional chart number 4 here, because I think this is something I developed, September 2021. And this shows the number of daily cases of COVID. And you see it's peaking in January. Right as we're rolling out the vaccine, but we really haven't injected it with anybody. If by the time we had any kind of significant uptake of the vaccines, we were way down in terms of the number of daily cases. I mean, this virus was burning itself out. Okay, now we had different variants. Again, I've read a lot of information about vaccination into the midst of a pandemic driving variants. Is that what happened? I don't know. But you would think if a vaccine were that effective, the tail would just continue and the pandemic would be over. But that's not what happened. We had a whole new surge, and this is Delta, and doctors I've talked to, very deadly, probably a more deadly. Would you agree with that, Dr. McCullough? Delta was more deadly. I know you guys are kind of freaking out that your early treatment wasn't working as well.
It was definitely more difficult to treat. But fortunately, by that time, we had treatments.
But anyway, I just wanted to put this thing up here again. To a layman, if the vaccine really worked, was that efficacious, prevent all that disease? By the way, they all admitted that it didn't prevent transmission. They lied to us about that for 4 months, maybe a year. Then they finally had to admit it didn't prevent transmission. But again, this chart right here just shows you that if the vaccine really would have worked, you wouldn't have had this. You wouldn't have had this. But I'll turn it over to Senator Blumenthal.
Thanks, Mr. Chairman. And I think we'll try to certainly stay within our 7 minutes so our colleagues can have their day of questioning.
But again, we'll have second, third, fourth rounds. I mean, we'll use up the time in this hearing room.
The debate here seems to be about the efficacy of COVID-19. But the central issue that brings us here today is the allegation that there was purposeful concealment of knowledge.
Which is the point he just made.
And evidence. And I just want to make the point, I may be sounding a little bit like a lawyer, not a physician, but purposeful concealment, intentional hiding is essentially undocumented by the evidence released by this report itself. In fact, the documents released by the majority today show that public health officials took multiple steps in the spring of 2021 to make healthcare providers aware of.
Well, how are you supposed to document people not reporting stuff? I'm sure people who commit murder document their crimes all the time. Like, that doesn't say anything.
They were rare reports of myocarditis among vaccine recipients. On May 14th, almost 2 weeks before the CDC decided to issue clinical consideration.
Define rare. Like, you gotta ask these guys to define just absolutely everything. It's always a word game with these guys.
Rather than a HON on myocarditis, which is, by the way, the primary piece of evidence that the majority cites in this so-called cover-up. The CDC's National Center of Immunization and Respiratory Disease sent an email to state and local health departments around the country entitled, quote, "Monitoring Reports of Myocarditis," end quote. The email noted risks and contained a reminder that providers were obligated to report cases. 5 days later, they sent out a follow-up email urging recipients to let providers in their region know of risks and reminding them once again of the obligation to report cases. I have 2 emails here that are in the majority report. They're available to the public. I ask that they be made a part of the record, Mr. Chairman.
Objection?
I'm not going to read them. They're for everyone to see. One begins with, "I would like to flag a message we sent out late Friday night. I encourage you to forward this important message about vaccine safety and reporting," and it goes on. Warnings. Far from a cover-up, these public health officials were trying to alert scientists, doctors, the public about the potential side effects.
First of all these doctors were ignored. Second of all, you just made this giant case earlier about vaccines or these mRNA vaccines saving lives. So which is it? Did it save lives? Were these things so negligible it didn't matter? Or were doctors trying to warn people? Like, yes, obviously there were people screaming their heads off about it. They were ignored. That's the point. And you were sitting there earlier denying that that was the case altogether. All right.
Mr. Siri and I are both trial lawyers. And
Maybe that explains it.
issuing that kind of
Sure, there's
warning
some good
is
trial lawyers
far
out
from
there, maybe,
evidence
probably.
of trying to hide or conceal something. You can say they were wrong somehow, but intentional cover-up is not within the realm of the plausible allegations here. So I think we need to be really clear and careful when we start discrediting scientists or public health officials.
This is
I'd
such
like
a
to add-
ridiculous claim. You've got 5 doctors, let's say, screaming that there's a problem, and then you've got 20 doctors saying there isn't. And because there were 5 doctors warning about it, therefore there's not a cover-up at all, even though the other 20 suppressed those 5 doctors' voices in the first place. It's patently ludicrous. In the words of Francis Collins, some people just die. Let me play my guitar and talk about what a wonderful Christian I am.
Ask Governor Green, can you tell us how, as a physician, publicly funded research, which is being cut by this administration, is important to establish not only new vaccines, but also the
Could it be
safety
cut from
and
the administration because they're lying? Just food for thought.
efficacy of ongoing use of vaccines?
Thank you, Senator. So, as governors, we rely on funding to do so many things from the federal government. And Cuts to research will be devastating. You can't just simply pause research and wait until a different ideology resumes governing, or until we get through these hearings and we restart critical research projects. We will lose ground on this science and the science that benefits from it, the R&D that goes forward. We've all been very supportive for decades of advanced scientific research.
The R&D
sometimes
that's being practiced on you, the people, by the way. But anyhow.
happens through the military, sometimes through our universities. We are in deep trouble if we stop the research component of our commitment to our people. We will also be in grave danger if we don't do the public health assessment in our states, in our rural areas, because we will not even know what we're being affected by. We will be blind to the diseases that roll through our communities, whether it's chronic disease or acute disease from an infection like this. And I just need to address a couple statements that I feel are misconceptions. And I'm not judging. I feel that there is a misconception that the COVID vaccination didn't decrease the severity of disease. That is what it did. It decreased the severity, and I saw this clinically, and we saw this from a public health standpoint. It decreased the severity of what people were facing. So they
How
didn't
do you
die,
measure
but
that?
They died at a much lower rate, and you can see that in the charts that we've seen, but through looking at them through a different lens, the exact same charts. When the
How do you
death rates
measure that?
drop-
Okay, rate your cough from 1 to 10. 1 being and 10 being I lost a lung. Like, how would you measure? We decrease the severity. How? Some details would be nice.
Because people had begun to develop immunity, because their immune systems were responding to the vaccination. And in fairness, we could debate the language, but even some of the individuals that are also testifying with me here today referred repeatedly to the mRNA vaccination because it was putting these particles into people, and then the immune system was responding to them. And so I do feel that it's a vaccination, but be that as it may, we ultimately saw the ability to stop the severe and deadly cases in our hospitals. And so there are many ways to view vaccinations, there's many ways to view treatments, and they're all valuable. For some, vaccinations straight up stop infection from occurring. That's the case when we talk about measles. Measles, mumps, rubella, when you get that vaccine, you really prevent the spread to a great degree. And it was commented earlier that we were misleading, or we were being misled by others on what the vaccinations were doing and what the information was that was being shared. Well, let me tell you what it was like during that period. And we all saw it. There was a great deal of confusion because the unknown was so enormous. And to the credit of scientists and to the credit of those who invested in the research at, again, extreme speed and extreme dollars, we were able as a nation and a global community to find our way to something that helped us. Now, of course, there were some tragic outcomes, and again, not a single case should ever be dismissed, minimized. No one should be impugned. But the grander picture of a vaccination program is to protect all and to find a way to protect people so that they can also help protect the people around them, which is why the research is important, the spending is important, why I'm very concerned about the announcement yesterday that we will only be recommending vaccinations for people over 65 or those with chronic disease, because a couple points. One, first of all, and I'm sure many of you had this experience, the chairman mentioned going to Swarthmore College, which is my alma mater. The president of our class, named Nick Jesdanin, 51 years old, unvaccinated because the vaccinations were not yet available, healthy, a marathon runner, died of a COVID infection. He was a prominent writer, an extraordinary human being, but utterly healthy. And that may have been, of course, more rare than an 82-year-old or
At least he went into a specific this time. I'll give him credit for that.
1-year-old contracting COVID and dying. But it does happen. He is an individual that would have been vaccinated immediately when given the opportunity. And also, the reasons that we were able to avoid so many unnecessary deaths in a very difficult to treat state, where we have 1, 2, 3, sometimes 4 generations of people living under the same roof with one provider. The challenge there is if we suddenly can't vaccinate teenagers or people who are 28 years old and are the breadwinners for their community, and we have another pandemic, or we have this outbreak worsen again, they will come home with the disease and very likely spread it to those who are vulnerable. And so I'll pause there. I just say that we should give people choice and we should honor and respect their stories, but we have to do the research.
Yeah, the
But there's
research
sort of-
says that those people who would be younger taking those vaccines, those mRNAs, would develop something that would kill them anyhow. The risk is disproportionate. That's the problem.
Haven't been honored and respected. Our next question will be Senator Kim.
Yeah, thank you. Governor, I guess I just would like to stay with you here for a sec, because I think you have an interesting perspective, someone who's both a doctor as well as an elected public official in an executive position. And I'm trying to digest the information that I'm hearing here and thinking about how to talk about it to my constituents back in New Jersey. And if they're watching this, I think that a lot of this is beyond what the average person understands. It's beyond what I understand in terms of the fullness of what happens in terms of our health system. So from your experience, Governor, when these cases come forward, these cases that Dr. McCulloch and others have raised, in terms of these concerns, what's supposed to kick in? How does this system work? You talked about this, saying that, we have a robust system for safety, that the system is designed to monitor, identify, and transparently report possible side effects, to review. Can you explain to me and my constituents, how this unfolds and what to expect?
Yes, thank you, Senator. So the way it should work is that we totally support science and we support public health, so that we are able in labs and in public health offices to take in the concerns, the complaints, the vignettes, the data, and analyze it thoroughly. And to the chairman's concern,
That wasn't an answer. Poor guy. He actually asked a sincere question, and he just got a dodge. Very cold dodge. It was a friendly question, too. Oh, the way that we should answer your question is we just gotta trust the science. We gotta trust the science so we can do the research. Research that our scientists aren't reporting. But we should trust them. I mean, the science. Yeah.
I'm sure some people were not listened to, or they felt not listened to, and that should never happen. That is one of the great challenges of our modern time, where we're talking past one another, where
Talking
when
past
people are-
one another. My friend took the vaccine and died. I don't understand what you're saying. That's madness. Are you insane, sir? I ain't reporting that.
are spreading their stories anonymously. Sometimes they're spread in ways that are not really even from the individual who's suffering themselves. There are great challenges, but we have to have this robust system. And how do you talk to people? How did I talk to people? In my state, and many people feel that we had the most positive and effective strategy to deal with COVID, was because we did something very simple. It was partially accidental. In the early days of COVID, I started a whiteboard, and ultimately tens then hundreds of thousands of people followed this whiteboard. And just so people know that it didn't have bias, implicit or otherwise, it didn't have partisanship, I just put the actual numbers that we had to the minute of how many cases that day, how many people were vaccinated, how many beds we had, how many intensive care unit beds were available, how many ventilators were available at each facility, how many infectious disease doctors, and so on. So that if someone truly didn't believe COVID was a threat, and some people felt that way, they could just look at the data and decide for themselves how they would respond
But
in
the
their lives.
accusation is the doctors were lying. The people giving you the data were misrepresenting facts. They were killing people and calling it COVID. That's the whole accusation. So, like, you getting numbers secondhand really doesn't tell us anything, does it?
This is how you talk to your constituents about something that's this disconcerting, in fact, terrifying. And we just showed day after day after day in a brief moment, sometimes 90 seconds, exactly what we had as the best data, long before we had these very complex reports from Johns Hopkins or USC or other universities, okay? Before we had that, we had our capacity in our state to share with our people what we were dealing with. And so what happened? Now, people could argue about this, but I will tell you that I believe we had far more people get vaccinated because I just shared exactly what we were experiencing. And I'll tell you, I look back at some of those early reports, and I sometimes shudder a little bit because we learned so much, which is what happens with science during one of these crises. You learn as you go. There were times, as you know, that we didn't have the right recommendations on masks. And we, of course, could debate that in this room, I'm sure. But we gave our best scientific data and our best experiential data. And that's how you talk to people. And yes, you never tell people that
And
they
I don't
are
know
not
how
vac-
they ran things in Hawaii, but part of the problem was they were making everybody wear masks. They were doing things through compulsion while they were learning as they go. That's part of the problem. And a bunch of people died because they didn't have all the information.
valued, and you never just dismiss their stories. And I'm positive I or others have been guilty of that in the moment, and we shouldn't be. But we also should not demonize one another. And when we, in my family, ultimately had protesters, which did, to a large degree, cross some lines, when some people were just communicating with me. Other people, I have to be honest with you, some people wrote swastikas on signs that were next to my home. Certainly, my father's Judaism had nothing to do with my COVID response. But I can tell you that sometimes because people were traumatized, and I understood how scared they were, and I understood what they were hearing out there, but that's how you talk to people. And if we do that after not, and I have to be honest about this, if we don't systematically dismantle our public health system, we'll be okay. We will find common ground, even though I suspect that there are some pretty significant differences between me and some of the other testifiers on what we would do with the next pandemic. We would actually be able to still move forward together.
Yeah, I mean, I think, something you said earlier I thought stuck out to me, the sense of that, no one should be ignored. I think that's a principle I hope everyone here can agree upon, that I think they always have space for more transparency. But also just keeping in mind that broader context. I mean, as you're saying, here are the
But the
challenges.
fact is they were ignored. How do you fix that? That's the question. Yeah, nobody should be ignored. Everybody agrees on that. But they were. So what do you do?
That we're facing when it comes to this system and how we can work on it. And certainly, I can imagine your experience, whether on addressing COVID or in Samoa, certainly that becomes more difficult to fully enact this monitor, identify, and the transparency report. When you're in the middle of a crisis, when you're in the middle of the chaos, that's something I think we can try to do to improve. To the point that was raised earlier, I think a lot of this also says this is a reason why we need to invest in capacity, invest in personnel, people working in our government to do this, and as opposed to cutting back on staff and trying to say that we need simultaneously more transparency when that becomes all the more difficult. But I mean, look, I understand, and I've had people in my life that have been ignored and not believed, whether that's, my time as a diplomat.
Yeah, but the
before.
people who did the cutting were the ones that were doing the ignoring. So now not only can we not throw these people in jail, we can't even fire them. There has to be accountability for the system. If they screw up, there has to be some way to pay for that screw up. But if we fire these people, then all of a sudden we're not taking the science seriously? Well, what exactly are you supposed to do then?
People I know struggling with Havana syndrome, and people telling them, I don't believe you, and other issues that are out there. But we should always have that system in place. And that's what I just hope we can come back to. I mean, I get it. I'm new on this committee, and I understand, and I'm seeing, years worth of back and forth that are coming here. But someone who's coming with some fresh eyes, I hope that we can try to cultivate that sense of trust that I know has been so deeply wounded, because I worry about what comes next. I worry about how we deal with the next diseases, the next pandemics, how we try to move forward and understand how this technology
It's
is
just
of-
such a telling word, wounded, implying that people were actually ignored. People did get injured by the mRNA, and they were ignored. Therefore, their trust was wounded. That's the whole problem. These people lied, and there's no accountability. You want to improve the system, you got to create accountability. But these guys don't want that accountability. They don't want anybody fired. They don't want anybody going to jail. They don't want to admit that the lies were as pervasive as they were. In the name of trusting the science. We can't create the trust through, consequences. No, we just have to believe. We have to believe. Like science. I mean God. I mean science.
mRNA and others try to move forward on. So I just appreciate, being able to hear this all and try to figure out how best I can be able to relate to the people in New Jersey, around this country, about the safety of the COVID vaccines that I have seen be able to save lives, but also be able to assure that we won't ignore people if they have other concerns, and we do our best to be as transparent as possible and to be careful of accusations of personal malfeasance, especially with some of our public servants, in terms of whether or not they were intentionally withholding information or not. We need to be very careful about those accusations on this committee. And with that, I'll yield back.
I will say we are just seeing the tip of the iceberg here, and you will see more evidence. Trust me. Senator Marino.
Well, first of all, thank you, Chairman, for putting on this hearing. I'm going to focus on, let's just stick to COVID-19 and COVID-19 policies. Let's not get into this conversation about vaccines writ large. Dr. McCullough, do you feel that you were listened to in 2021? Did you feel ignored?
Our November 19th, 2020 hearing, done for Homeland Security and Governmental Affairs, was very lightly attended by our senators who are working for us. That's a disappointment. It's disappointment there's chairs empty here. Our hearing was actively suppressed, scrubbed off YouTube.
So just to clarify, not only were your viewpoints ignored, you were called a conspiracy theorist, a spreader of misinformation, somebody who didn't know what they were doing, by people who didn't even take a science class in high school. And yet you're a doctor and you were completely ignored. Let me ask you, Dr. Vaughn, real quick question. How many children under the age of 5 years old died of COVID?
So very, very few. Actually, theoretically, a healthy child under 5, there wasn't any.
So basically zero?
Yes, it's
How about under
statistically
the
zero.
age of 10?
It's still statistically zero.
15?
When you get up
15?
into the 15, 16, I mean there is some.
So under 15, none?
Yeah.
Pretty much, none?
Statistically, yes.
All right, so I'm confused because Governor Green said he held the children who would have died
Oh,
from
good
COVID.
catch.
That's crazy because evidently nobody died of COVID who was under 15. We're talking about, but see, that's the confusion. See, when we talk about COVID vaccines and then we stick in other vaccines, we get off topic.
Very nice, good sir. Way to call out that bait and switch. Very nice.
Because COVID-19 wasn't about measles. Now, Dr. Thorpe, do you think, good idea or bad idea, that you should close schools?
Bad idea.
Now,
Bad idea.
Now, why? I mean, kids can learn at home, can't they?
They can learn very well at home, but at school, they will have the opportunity to develop natural immunity.
So, and school, well, by the way, schools is where you socialize, you learn your behaviors, you learn how to meet other people. Because if we don't believe in schools, the federal government and state government can save a lot of money. So schools are important. Let's just get that out of the way. So why would you close schools, which you did, Governor, when no children died of COVID? What would make you make that decision? You close schools. And by the way, the impact on that is generational. You destroyed the lives. You and the other governors that closed schools destroyed the lives of children in doing that.
So, okay, I've got to tell the audience, please notice terms.
Senator, may I,
It's been
may I
like the most
respond to that?
entertaining part, though.
Yeah, I think it was. Well, first of all, I think you misunderstand some of the value to.
No. Why did you close schools?
I'm going to address each
Just
of your
answer
points.
that and not filibuster me, please.
I'm not going to filibuster you. Schools, I did not want to close, and
But
we
you
tried-
did.
Actually, I was not governor at the time.
But you were lieutenant governor and you were the point person. Do you think the governor made a mistake in closing schools?
We reopened the schools as soon
Did
as
you
we
think
could get
he
the
made a
teachers as soon as-
mistake?
Well, if
Do you
I
think
can,
he made a
may I
mistake?
answer the question, or is this senator going to filibuster me, sir?
No, you're going to answer my direct question or just say I'm not going to answer you.
No, I'm gonna answer your
Do you think it
question.
was a good idea? Yes or no, the two choices in this answer. Do you think it was a good idea to close schools? Simple answer. Just give me a yes or a no.
As we had COVID surging through our society because there was massive spread from children to adults, we were waiting to make sure the teachers
So let me get this straight. You sacrificed the lives of children because maybe they would spread something that you don't know to adults. You thought that was a good idea. That's
No,
interesting.
that's
Okay.
not always it. Actually, it's your
okay.
party that's
We're good.
trying to
We can-
close
we
our
can-
schools
we
and get
can-
rid of the Department of Education. So
That's-
we have
Okay.
we do have
So we're not
differences of
politicizing
opinion.
this hearing. Okay,
No,
we're moving on.
You said my
We're
governor and
we're
the other governors that close schools, which is a politicization
Look,
of the issue.
when I'm in Hawaii and I'm having a hearing before you, you can interrupt me. When
I will.
You're here before the United States Senate, you're not going to interrupt me. Moving on. So here's the next question for you. Show me the science that said that when I walked into an airport in Hawaii, and I wasn't, I didn't want to tell you because it's none of your business whether I had a COVID vaccine or not, or tested positive or not, because that's also none of your business. Where's the science where I had to quarantine for 14 days? Tell me the science behind why you locked your residents up and did not allow them to go grocery shopping, why you closed your beaches and your parks. I would love you to put that science into this record because you can give me the nice, happy talk, but those were terrible decisions. And what COVID highlighted more than anything else, by the way, it's why I'm here. I ran for the United States Senate, not because I had this deep desire to be a government politician, but because I was so incensed by the arrogance, by the ignorance, by the lack of common sense among our elected officials that we needed different kinds of people here in Washington, D.C. and other places. So,
Should I answer those questions, Chairman?
no, there's no question for you. That was just a
There were
statement.
several questions.
No,
You asked about
no.
why a 14-day quarantine. You asked
Yeah,
about
what's
what
the
the
science?
airports.
Sure, what's the science? 14-day quarantine.
Because the-
Not 12, not 16.
Actually, I asked for 5 days, just so you know.
So
With
what
my-
was it? Was there a dartboard?
No, it was 5 days because that was the amount of time from symptoms to transmission.
So
that
why
we-
14?
The 14-day was before we had the
So 14 wasn't scientific, just to be clear.
14 days was how long it took for people to get over the disease, and people were still shedding virus through that period, and that's why you do use science and I use science, but you didn't like science for Hawaii.
Did
We
the
did
COVID
have the test, and we did have the test to enter Hawaii, so people could make a choice, an informed choice, and they did. And then they didn't have to quarantine at all. Just to make sure you know that, because I think you got your facts wrong. And also, I didn't close the beaches. That was the mayor of Honolulu and not me. So just, it is important that you get the facts right if you're going to be a political official.
So that's what you're saying. It wasn't me. It was the other guy.
No, it was me who ran the COVID response.
Zero accountability. Dr.
Well,
McCullough,
I'll take more accountability if you give me more time.
I'm done with you, Governor. Thank
Oh,
you.
thank you, sir.
So, Dr. McCullough, quick question for you. Just completely objectively. Look, I went to business school. I was not a doctor. So I'm going to truly objective, using your most subjectiveness here. Did the vaccine stop the spread of COVID-19?
No.
So then let me ask you one simple question. We'll go down the line. You guys can answer it. It'll be my last question. So if COVID-19 did, the vaccine, the injection, did not stop the spread of COVID, why is it that Joe Biden, President of the United States, issued an executive order, which was ruled unconstitutional, by the way, that said that if you worked for a company with 100 employees, because not 99, 100, that you would be fired if you did not prove you didn't have a COVID vaccine negative test or got vaccinated? Why would we have some decision like that? How depraved do you have to be to do that? Answer the question the way you feel down the line. Go ahead, we'll start with you, Mr. McCullough. Doctor.
Briefly.
My testimony on this issue went all the way to the Supreme Court that overturned 4 out of the 5 Biden mandates. They were scientifically ungrounded, they were sociologically deranged, and they caused great harm. To this day, people are in court trying to get their jobs back and trying to put their lives together because of these disastrous policies.
And just to be clear, sorry, Chairman, nurses were included in that, correct? Healthcare workers. The ranking member called them heroes. It seems to me that when you have a hero, you don't terminate their ability to make money and have them fired because they're making a personal choice. Because he ultimately, and I'll end with this, ultimately, this is what this is all about. See, I get to get a choice if I'm going to get vaccinated. And if it doesn't stop the spread, it is none of any other human being in this country's business what I did or did not do. Would you agree quickly?
100%. And I think Director Walensky, when she said of the science of hope, that is not science. Science is facts. Hope is
Science
not
of
science.
hope. That's rich. Huh. I hadn't heard that particular story. The science of hope. Just take that little mRNA and hope. Hope you don't die. Hope you don't whatever. Huh.
Thanks, Senator Marino. Again, please, let's not express any emotion out there in the audience. Dr. Walskog, I just have to go to you because you have direct experience. I almost feel like bringing up Breanne Dressen to talk about the concealment that you witnessed firsthand when it came to your working with, Bree's working with NIH officials, trying to do studies, being carried along with some assurance that this was going to be revealed to the public, and it never was. Just talk about that level of concealment. Again, there's going to be so much evidence of this if it hasn't been destroyed. This is just the tip of the iceberg, what we're seeing here with myocarditis. But talk to what you and your fellow vaccine injured who were dismissed, who were gaslit, who were treated horribly. I mean, horribly when you came to the United States Senate and asked to be heard by senators and their staff, you were treated. Describe how you've been treated.
Well, thank you, Senator Johnson. So what I'd like to say is being vaccine injured in this country is unfortunately a huge polarizing event, which it should never be. If I could describe one word that I think all, if not most, vaccine injured will say is, what's one word that describes your experience after your injury? And it's abandonment, okay? We get attacked, we walk a tightrope. We get attacked from the right say, we're stupid, we shouldn't have got a shot, we should die. Okay, and I could show you social media stuff. The left says we're anti-vaxxers, which to me is one of the most ignorant things to say of myself because all my children have been vaccinated. I got vaccine injured because I got vaccinated. But still, regardless, we get called anti-vaxxers. We report these to VAERS, okay? Nothing happens.
It's almost like these people make their money off gaslighting or something.
Adverse event, which was, delayed the AstraZeneca trial in the United Kingdom, 2 times for 3 cases of transverse myelitis. I expected a call the day after. Days passed, weeks passed. By 3 weeks, I called the CDC myself and demanded, a response. I always thought, I'd get this quick response and someone would help us. All of us that are vaccine injured know there's no phone call coming. There's no help coming. We have repeatedly met, and Breanne Dressen, who's my co-chair with Reacting, have met with Peter Marks over and over and over for the last, for a period of about 2 years. We have been placated. We have been blown off. We bring up adverse events, the neurological adverse events. We bring up the MIS, which is the multi-system inflammatory syndrome. We bring up the myocarditis. He thanks us. He says he'll get back to us. He never does. That went on for 2 years. So for people that think it's this kumbaya where people are listening to us and people are all in these federal agencies are trying to help and get to the bottom of it, it is the farthest from the truth.
So there have been a number of claims made, and I think there will continue to be a number of claims made. I just ask anybody making a claim, please provide your citations. Please provide, again, respect the science. Let me see the science. I mean, I'm very genuine here. Let me see, the science behind this actually reduced the symptoms, or this prevented deaths, or this prevented transmission. I would like to see the science.
They're probably ain't going to do that because it's going to be like Blumenthal. It's all going to be like a blog or something, some kind of faux math to, make it look like make the results look a certain way.
You were really specializing in the blood clots. I've seen video after video, picture after picture of these long white blood clots in autopsy. We've also, throughout COVID, autopsies were really discouraged. We weren't seeking the scientific truth. I see Dr. McCullough, I'll have you kind of answer that, but Dr. Vaughn, first talk about the clotting we saw and what you know in terms of what was discovered under autopsy.
Well, first of all, early in COVID, the spring of 2020, my collaborator, Jacques Lobscher in South Africa, was the first one to kind of alert people to say that this was primarily a vascular disease, not a pulmonary disease. And that's one of the reasons that ventilators are probably one of the most ineffective things you could have done to people, because if you have a vascular disease of the lungs, increasing the intrathoracic pressure just closes down more vessels and ultimately kills them. And what we also saw was if you went into the hospital in the spring or summer of 2020, you were twice as
Which
likely—
a lot of hospital staff knew. And putting them on the ventilators for that specific result was the point.
to leave alive if you were already on a blood thinner. Now, I will
Which is
tell
what
you—
happens when you're getting money for every COVID victim, by the way.
Most of your friends that are on blood thinners probably aren't healthier than you. So it's kind of interesting to find out that the people that were on blood thinners had a protection. So again, those were signals that were really downplayed. Unfortunately, after a lot of the treatment was codified by the CARES Act, it resulted in basically a protocol-based treatment for in-hospital care.
As long as you start, can anybody describe remdesivir? Anybody want to speak to that? If not, I'll do that for another hearing. I mean, just the conflict of interest of how that was being approved. So we'll wave off on that.
But what we uniquely found, and my collaborators in South Africa, Risha Pretorius and Doug Kell at University of Liverpool, was that the spike protein was able to induce fibrin from fibrinogen, which is a fancy word for saying, hey, forming the backbone of clotting. But it did it in a way that was different, that we had not seen. And it was what we would similarly think of fibrin as kind of like spaghetti coming out of the colander that you could pull apart when you didn't need it. It was easy to break down. But the actual clot that was formed in COVID or from the spike protein from the vaccine was like burnt spaghetti casserole that you have to get a Brillo pad to get off the dish. And a lot of people, their issue is their inability to break down that clotting mechanism. We all need to clot, but we all need to actually get rid of the clot, and that is the problem.
That was pretty obvious. It was ignored. Dr. Thorpe, I'll get to you, but Dr. McCullough, real quick.
Quickly, in the last 5 years, I've never treated as many blood clots in my entire multiple decades of in clinical practice as a cardiologist. The blood clots occur after the infection with the virus and the vaccine because the spike protein causes blood clots. It's without any controversy in medicine, the spike protein causes blood clots. So it is reckless and foolhardy to continue to vaccinate people and load the body with spike protein and cause more blood clots.
There were other parts of the coronavirus that they could have used in the lipid nanoparticle. I mean, they could have injected something else that wasn't quite so toxic.
Yeah, and actually, a paper in Cell, July of 2021, it's called Broad and Durable Immunity from basically COVID. And what they found was the nucleoprotein was actually the thing that supplied broad and durable immunity for actually prevention of infection. Unfortunately, the spike protein did not elicit that response. And as much as we love this mRNA technology, it seems like they sold it as something that we could change on the dime as information actually came to light. And by July 2021, we knew the wrong protein had been picked. Why didn't they change it?
That's a good question. Senator Blumenthal.
Thank you, Mr. Chairman. Dr. Vaughn, I noticed that you were careful when you said that children didn't die of COVID to say statistically, which I appreciate. 1.2 million Americans died of COVID-19. Tragically, more than 1,000 of those deaths were children. in fact, 700 were 4 years old or younger. And I'm sure you will agree that those deaths were tragic, and most especially for the families who will never be the same. Children were affected by COVID. There's no question that children died, but equally important, the trauma of COVID affected children. The fear and anxiety that spread throughout their families. You don't have to be a doctor
Yeah.
to understand that point, or a parent.
Yeah, I have a 7 to 9-year-old, and it was a very interesting time. But in many
So
ways,
TTN DJ MC says, got him. I'm not sure who he is referring to, but I am curious to see what his response is to that.
Well, interesting is a somewhat euphemistic way of putting it. I'm
Yes.
sure you'll agree. But let me just point out that our entire society was traumatized by COVID. People were out of school. We can argue about the merits of whether they should have been, but it has affected our entire society. And just so we're all on the same page here, I'm in strong agreement that schools are good. Kids should be in school. Let me point out, though, because we want to learn from history here, that when there are side effects, when there are threats to public health, there should be warnings. The public should know, so should doctors and researchers. And right now, I'm looking at a report from NPR. It's dated May 21 of this year, which describes the effects of cutting back on the CDC's capacity to warn, and says that many of the platforms, quote, many of the platforms the CDC used to communicate with the public have gone silent, end quote. It says, quote, many of the CDC's newsletters have stopped being distributed. Workers at the CDC say health alerts about disease outbreaks previously sent to health professionals subscribed to the CDC's Health Alert Network, HAN, haven't been dispatched since March. I understand the concerns that have been expressed here, and let's learn from scientific practice. And
Okay, so let's take that number at its word. So he's saying 700 people died, children died from the COVID vaccine, or under a certain age. I don't recall off the top of my head what the age was. Whereas the other guy said it was statistical. So statistically, no children died. So I'm not sure. I guess that means if it's below a certain number, then statistically it doesn't count, I guess. But even so, the next question you would have to ask is, okay, well, how many of them have actually died from myocarditis and the vaccine? And then you would have to compare the two numbers, and then it would be a risk assessment. That would be my gut response to that, I suppose, is, okay, what's the risk of dying if you have COVID versus the risk if you have the vaccine? But yeah, that statistical comment was a good catch. I will credit Blumenthal for that. However, I would like to see what the numbers of children deaths with regards to vaccines actually are.
make sure that the Department of Health and Human Services provides the resources that are necessary to warn the public. I want to ask Dr. Brown, because you've talked about both your experience in Samoa in 2019 with the measles outbreak there, which eventually killed 83 people, as I understand it. Again, measles was thought to be eliminated in the world.
So we go from having a decent point to having a stupid point. Again, we've already talked about the mRNA is distinct from the measles vaccine, so even equivocating the two is a bait and switch. So I'm not sure how relevant this actually is to the question at hand. The whole point of this Senate hearing is that people are being disproportionately affected by the mRNA, and yet the scientists in question will not admit it. And so people are being ignored. These vaccine injuries are being ignored. So what measles has to do with that, it's just basically to create this sense of fear. If we question the mRNA, then we're going to question all vaccines. And everything's going to be bad, and the institutions will fall apart, and they'll fire a bunch of doctors who don't need to be fired. It's fear-mongering. No, we're talking about the mRNA specifically. We hope you enjoyed this episode of Faith, Fiction, and Folklore. If you did, we would love it if you would subscribe to us on YouTube or follow us on Rumble. We can also be found on X, Instagram, and Facebook. And we are available on Spotify, Apple Podcasts, Amazon Music, and iHeartRadio. Thank you again very much for listening, and we'll see you next time.